Some good news on the global fight against COVID-19. Infections and deaths around the world are dropping steadily, according to the World Health Organization. COVID-19 cases have been declining globally for weeks now. Last week alone, there was a 12% drop in new cases compared to the previous 7 days. Dr. Maria van Kerkhove is the COVID-19 technical lead for the World Health Organization. She's in Geneva. Dr. van Kerkhove, we are seeing worldwide COVID cases are on the decline. Can you tell us why?
I think there's a number of factors of why we're seeing a decline in both cases and deaths. We are seeing on deaths, let's start with the deaths first. Number one is that we're seeing increased rates of vaccination coverage, primarily amongst those who need them most, those who are over 60 and people with underlying conditions. But we're also seeing declines in cases from a number of factors. People who are reducing the number of contacts that they have, the use of the simple measures like a mask and physical distancing. And vaccines are actually also having an impact on reducing transmission. Even though that's not their primary focus, we are seeing some benefits of reducing transmission as well. But it's likely a combination of factors. There is no one magic bullet for this pandemic.
So while the numbers are headed in a better direction, and you did specifically mention vaccines, there are still some major challenges when it comes to vaccine equity. Where are you seeing the biggest disparities right now?
So there are massive challenges to vaccine equity right now. And of the more than 6.6 billion doses that have been administered so far, about 70% of those have been administered by only 10 countries. We are seeing huge inequities in low and middle income countries around the world. Our focus, and through the COVAX and all of our partners as part of COVAX, is to ensure those who are most at risk, people who are above the age of 60, people with underlying conditions of any age, plus our frontline workers, health workers, receive their first and second doses in all countries before some populations vaccinate all of their populations and give that third booster dose. We aren't seeing enough vaccine equity, and this is really driving transmission because people remain susceptible and people without vaccination are dying unnecessarily.
Did you think, where we are, given where we are right now in the pandemic, that perhaps the world would be further ahead when it comes to vaccine equity and just getting shots in arms?
Absolutely. I had hoped that we would be much further along in terms of having control over this virus, given that we have so many tools right now. Vaccines and vaccination are only one tool, but we have a number of others. We have masks, we have distancing, we have ventilation, we have avoiding crowded spaces. All of those measures are really important, not only to save people from getting infected and developing severe disease, but to prevent the spread. One of the major drivers of transmission right now are these virus variants, the variants of concern. And the latest variants of concern, the Delta variant, is more transmissible than even the ancestral strain or the Alpha strain. And so that makes control that much harder. But I had hoped, and it's not a matter of hope. We need steps taken to actually ensure that people use the right tools, making sure that countries and people have access to the vaccine is of primary focus for us right now. But it isn't the only measure that we have at our disposal.
A lot of the time when we talk about vaccines and we talk about disparity when it comes to equity, we talk about numbers. But can you sort of tell us what it is like in some of these countries on the ground that don't have access to vaccines like we do in Canada and the United States?
Well, the virus is spreading among unvaccinated individuals or underprotected individuals. And those who don't have access to the vaccine are at a higher risk of infection and death. In a number of countries, we are seeing surges of activity. And while we see at a global level, we're seeing declines in cases and deaths, there are hotspots of activity, intense transmission in all of WHO's region, not in every country at the same time, but really in too many countries for me to even list here on your program. And in countries, they're really grappling with how do you deal with this pandemic 21 months into a global pandemic. The world is fatigued, and it's very difficult to keep up these measures because they have not only an impact on our social well-being, but they also have an economic impact as well. And frankly, it's just not fair. We have enough vaccines. If there had been a better use of the 6.6 billion vaccines that have been administered to date, we would be in a very different epidemiologic and economic and ethical position than we are in today.
When you say, better use, what does that look like to you? Paint a picture of what that looks like.
It means primarily focusing on getting the first and second doses into the arms of those who are most at risk. So people who are of older age, people who have underlying conditions in every single country, and our frontline workers. Our targets were 10% of the population in all countries by the end of September, and many countries didn't reach that goal. 40% of populations in all countries by the end of this year, and 70% of all populations by the June 2022. We can do this. I think we need to keep telling ourselves that we can do this, but we need more production. We need better manufacturing. We need countries to have access to be able to purchase the vaccine. We need to share technology so that more vaccines can be produced. There are so many problems that the world is dealing with. COVID-19 has solutions. We just need to use them.
The World Health Organization announced a new task force examining the origins of COVID-19. China has not cooperated with these efforts in the past. What makes the World Health Organization think that this task force might be able to get to the bottom of this?
So we are taking concrete steps to further the study of the origins of SARS-CoV-2. This SAGO, this scientific advisory group that has just been formed, we've just announced the proposed members of this advisory group, will come together to work with us to outline a framework to study each time there is the emergence of a new or a known high threat pathogen. And they will outline what are the expectations to study each and every time this happens. This group will also rapidly assess where we are in our understanding of SARS-CoV-2 origins and what critically needs to be done going forward. We need the cooperation of all of our member states, including China, to advance those studies, but there is no time to waste. We're at a critical point right now, 2 years into this pandemic, where studies need to be done on the earliest cases where the first cases were emerged. And we are taking steps to make sure that these studies are conducted and working with China and partners around the world to ensure that that happens.
China has demonstrated through its past behavior that it doesn't cooperate with these kinds of investigations. And if you take a look at broader actions from the government of Xi Jinping, there has not been global cooperation on this. How does the World Health Organization get to the bottom of this? How does it get around China, since it does not seem to want to cooperate?
Well, there have been some missions to China, and we hope that there are more. There's much more work that needs to be done. The group that came back in March, published their report in March 2021, outlined 2-3 dozen studies that need to be undertaken. And those studies need to be undertaken in China. We do expect the cooperation, and we are working with our colleagues in China to be able to carry those out. But of course, we do need their cooperation. Much more work needs to be done. We're working behind the scenes as well as through our diplomatic channels and all of our scientific channels to ensure that that happens. But it takes a lot of effort to be able to make sure that these studies are carried out.
So if China doesn't cooperate, can the World Health Organization get to the bottom of this?
Well, we need our cooperation from our partners in China. There are a lot of studies that are underway looking at animal susceptibility, looking at tracing of SARS coronavirus-like viruses in bats in China and also in the Mekong region. Those studies will continue to be undertaken. We need to look at the tracing of animals that are sold in and around markets in Wuhan up until November, December 2019. We're also working with other countries that have found positive samples of SARS-CoV-2 in samples that were collected in 2019 in Italy, in France, and the US. All of those are being followed up. So we will continue to pursue this until there is no more left to pursue. So we will not stop until we have a better understanding. But finding the origins of the start of a pandemic, any emerging pathogen, is incredibly difficult. What we need right now is the space to work scientifically. We need to put the politics aside and continue to pursue all of these different hypotheses so that we can rule them in or out and take the next steps. But we really need the scientists. We really need to bring this back to the science and allow us to do our work with our partners.
Dr. Van Kerkhove, thank you very much for your time today.
Thank you so much for having me.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.